it without Kenyan partners. It just does not work. And so really, to me, the success of the PEPFAR program is really the success that has been enabled by our Kenyan team. And so all of these people who are sitting quietly around here and in the back, those are the folks who enabled our assistance to really become something that is keeping Kenyans, people who are from Kisumu County, healthy, vibrant, alive. I just really appreciate the stories of those who were suffering, 10, 15 years ago, but found their way through these important programs. And they're living healthy lives, they're being educated, they're earning money. And I do think, as Dr. Richard just said to me, this is the generation that is going to help us continue on our incredible path to reducing HIV prevalence, to having babies who are HIV negative. And again, we're just really grateful. On behalf of the U.S. government, thank you for what you do every day to enable us to make PEPFAR a success. Thank you.
Yes,
hey. Yeah, good afternoon, everyone. Now, we are very excited this morning to have the Deputy Chief of the American Embassy, Madam Carla Benini, together with the Deputy CDC Director, Chastity Walker, and the representatives of the CDC, CM, in Kisumu. They came to visit us as an hospital and also as a center of excellence in the management and treatment of HIV infected persons. They only came here to do an assessment and also to get first-hand information on exactly what we are doing in this center. So we at Jaramogi, we are very, very excited to say that we are the only two facilities in our country that have got advanced management of the HIV patients and also, management of violence, having a violence recovery center in our country. We want to say that we have done very, very well, in management of our patients. Here in Jaramogi, we are handling about 6,700 or 6,800 patients who get treatment here, HIV treatment and management. We also have about 800 adolescents also who are getting treatment in this center. And we are very, very excited to say that we were the first facility, since 2003, to manage HIV patients. And we are very proud to say that a number of those patients are still alive. In fact, we have the oldest cohort of those patients. We are also very, very excited to say that we also have a very big number of children born without HIV, having almost zero HIV transmission from mother to child. And we are very, very much excited about that. So today we were actually looking at the issue of adolescence. That we have really to focus as a country on how to assist our young men and women who are infected by this disease, some of them without their knowledge, some of them without necessarily having infected themselves. And we are very, very excited that some of you have seen today. Some of them, have continued to have drugs, to have medicines, adhering to those medicines, and they are negative. In fact, their suppression has come down almost to zero. And some of them have even gone to high school. Some of them are already married or actually having engagements. And that's actually what excites us. And therefore, that should be our focus. So I think that's all we have for today. I don't know unless you have any questions.
What you can tell us about integration?
What's very, very important here is that the issue of integration of management of HIV is actually cardinal and very, very important. And for us at US-JOOTRH, we actually began it a long time ago. And that's why we are saying that we are an advanced facility in management of HIV. Our patients, those who probably now have cancers, those who have got other conditions like, diabetes, those who have got hypertension, all those kind of other conditions, auxiliary conditions, with HIV, we manage them here. It's actually a one-window shop. That's why we are calling it a CCC, Comprehensive, Care Center. And therefore, that has been very, very useful. And I think that should be something that should be copied across the country. That you should not have HIV management isolated, on its own. And that's why we have specialists here. We have got the consultants, senior consultants in almost every field, and therefore they manage to integrate and manage, all other conditions affecting our HIV patients.
moment, nevirapine has been out of stock, but we've got one thing that we are working out to our mothers. As we said early, we have got 3 zeros: 0 missed appointment, 0 missed drugs, and 0 viral load. So even if the nevirapine is there, but this mother is not taking her medication, so you find that there will still be transmission to the baby. So we are working hard towards, as you heard, that we are at 98% suppression rate. Almost everyone is suppressed. We are still achieving that 0 viral load transmission to our children. So we are preparing them, and as they take their medications well, you find that they will not be able to transmit however much the nevirapine is out of stock. But we still have got other preventive medications like zidovudine, which are still being provided to our mothers, safety which are still being provided to our mothers to be able just to make sure that the lives of these HIV exposed infants is still going on the way it's supposed to go on. Also equipped. You know, we have people who are trained, displayed all over the country, all over the county. Even in that rural places, we have got those clinicians, community health assistants, we have got the community health volunteers who are giving this HIV education every other time. As you heard that we are also working out into pushing the Operation 000 to the community. The community health volunteers are already in the community trying to educate these mothers on how can we come up with a HIV negative infant. So we should not get worried for them that are in the rural places because the information is all over the county. I'm Petronila Msanga, clinician serving the adolescents in Jaramogi.
I think maybe I can conclude by saying that we in Kisumu County are actually leading. I think not only in Kenya, but I think even globally. We have our health promoters almost in every village. You know, we have got mentors almost in every village in this county. And we have got, you know, I think consultants and specialists, you know, not only in our sub-counties, but even in Jaramogi, Oginga, Odinga is supporting that. I think we should be, you know, a very proud county in trying to manage this condition. I think what we need to do is that just to put a comprehensive, you know, I think infrastructure to see to it that going into the future, you know, we don't necessarily have to entirely depend on donors, you know, entirely depend, you know, on outsiders and foreigners. I think we need also to start integrating, or now we can actually start becoming dependent and actually independent in managing this. However, partnership is very important. You either partner or you perish. Asanteni.